Hi everyone, welcome back to our channel, Bienestar Asesoría. My name is Audrey and this is my business partner, Fabian. Today, we're going to break down an important new Medicare program that can make a big difference for those of you on Medicare Part D.
That's right. We're talking about the Medicare Prescription Payment Plan, a new option coming in 2025 that lets you spread out your out of pocket drug costs over the year instead of paying for them all at once at the pharmacy.
Right, this is a big deal, especially for people who have high prescription costs early in the year. The new plan was introduced under the Inflation Reduction Act of 2022, and it's designed to improve access to the medications you need without breaking the bank.
So let's dive into the details. First, what exactly is the Medicare Prescription Payment Plan? Simply put, it allows anyone with the Medicare Part D plan to pay their prescription drug costs in monthly installments instead of paying the full amount upfront.
And the best part is this option is available to everyone with Medicare Part D, including those who receive extra help through the low income subsidy program. The program is particularly beneficial for those who face high out of pocket costs early in the year.
Let's give you an example. Imagine you have a $400 prescription drug cost at the beginning of the year.
Mhm.
Instead of paying all $400 at once, you can choose to spread that out over the year in smaller, more manageable monthly payments.
Now, it's important to understand that while this plan spreads out your payments, it doesn't reduce your total out of pocket costs. The amount you owe stays the same, but you get the flexibility to pay it over time.
That's right. And another key point is that this program covers all Medicare Part D drugs, so it's comprehensive. But if you decide it's not right for you, you can opt out anytime during the year without having to pay a lump sum for what's left. And if you're wondering about pharmacies, they're part of this too. If your prescription costs exceed a certain threshold, your pharmacy will notify you about the program, which can be a helpful nudge if you're facing high costs.
Right, Fabian. So let's talk about how you can join the program, right? Let's get to the good stuff. Starting in 2025, you'll be able to opt in before the plan year begins or even mid year by contacting your Part D sponsor. They'll guide you through the election process, whether it's online, over the phone, or by mail. Also, CMS, the Centers for Medicare and Medicaid Services, is working on tools and educational materials to help you decide if this program is right for you. And those will be available in time for the 2025 open enrollment.
Before we continue, let me explain what a Part D sponsor is. A Part D sponsor is the company or organization that provides your Medicare Part D drug plan. They're responsible for managing your prescription drug benefits. These include things like approving your prescriptions, setting up the pharmacy network, and determining how much you'll pay for your medications.
Right. And when you enroll in the Medicare prescription payment plan, your Part D sponsor is the one who handles your monthly billing and any cost sharing payments you have for your prescriptions. Think of them as the go to company that manages your Medicare drug plan and helps ensure you get the medications you need. Once you're enrolled, your sponsor will provide all the details, including how the monthly payments will be calculated and when your participation takes effect. Here are three things to remember before enrolling. One, enrollees can join the plan at any time during the year. Enrollment applies only to future prescription costs. And last, the cost incurred before enrolling must be paid directly to the pharmacy.
Remember, the Medicare Prescription Payment Plan doesn't actually reduce your total out-of-pocket expenses. Therefore, for those who qualify, there are programs like Low Income Subsidy, also known as LIS, or Extra Help, which can significantly lower costs. Be sure to check if you're eligible before enrolling in the payment plan.
Right. Once you're approved for the program, your Part D sponsor will provide a detailed overview, including when your coverage starts and how the monthly payments are calculated. They'll also give you information on the LIS program. This is because for those who qualify, the Extra Help program may provide more benefits than just using the payment plan.
Let's talk about how cost sharing works under the Medicare Prescription Payment Plan. Instead of paying large out of pocket costs all at once when you pick up your prescriptions, the program spreads these costs out. You'll pay nothing at the pharmacy, and your Part D sponsor will send you monthly bills for the total cost sharing amount over time. Your pharmacy will get paid by your sponsor.
And just to add to what Fabian is saying, sponsors notify pharmacies when enrollees may benefit from the plan due to high out-of-pocket costs. And this is a great proactive approach to assisting clients because not everyone is vigilant of their prescription drug expenses. So it's nice to have a second eye looking after this.
If you decide the payment plan isn't for you, don't worry, you can opt out. You can leave the program at any time by contacting your Part D sponsor. Just remember, once you opt out, you'll go back to paying the full cost sharing amounts at the pharmacy. One more thing to note, if you're already in the Extra Help program, you're still eligible to participate. But it's a good idea to check if this plan will be more beneficial for you compared to the Extra Help program alone.
Right. So to sum up, the Medicare Prescription Payment Plan is a great option for those of you who have high out-of-pocket prescription costs. So in September, be on the lookout for your annual Medicare Notice of Change letter, which will tell you how much your premiums, deductibles, and copays will differ in the year ahead and whether the plan will even be offered. Medigap plans, however, don't send these notices because they don't change much year to year. An annual notice of change from your Part D plan also says whether your prescriptions will be covered, and if so, how much you'll pay. A Medicare Advantage notice of change will tell you if your doctors and hospitals will remain in the plan's network.
Thanks for tuning in. If you found this information helpful, make sure to like this video and subscribe to our channel for more updates on Medicare and other important topics.
And if you have any questions, drop them in the comments below. We're here to help. Till next time, take care and stay informed.